Hello, I'm Dr. Margarita Yemelianova. I am gynecologist working in European Wellness Centers group. Today we're going to talk on genital rejuvenation. What is genital rejuvenation? It is a range of non-surgical methods that are designated to enhance genital aesthetics, sexuality, and functionality of women and men who want to restore the youthful appearance and function of their genitalia. Doctors like me, gynecologists, urologists, and dermatologists all perform non-surgical methods of genital rejuvenation. Today, with increasing life expectancy and women live longer, more than 20 million of women are affected by uterine prolapse, birthing injuries, and urinary incontinence. Causes for conditions such as vaginal relaxation syndrome and vulvovaginal laxity are vaginal delivery, atrophy, massive weight loss, natural aging, and smoking. Most of our patients are premenopausal, menopausal, postmenopausal women, women with premature ovarian failure or premature menopause. Overall, those who experience the symptoms of estrogen deficiency, meaning that the decline of estrogen and other sex steroid leads to changes of labia minora and majora, clitoris, vagina, introitus, urethra, and bladder. Estradiol, the man estrogen, controls a plethora of cellular pathways in our body, regulating their growth and proliferation of cells, barrier function, and pathogen defense. The main consequence of lacking estrogen stimulation is the loss of tissue elasticity, induced by fusion and hyalinization of collagen fibers and fragmentation of elastin fibers. The mucosa of the vagina, introitus, and labia minora becomes thin and pale, appears less hydrated, resulting in a painful intercourse and discomfort. Until recently, it was a taboo topic to discuss. Moreover, 40% of women experience psychological distress from their sexual dysfunction, but only 14% consult a physician about sex during their lifetime. Nowadays, through public awareness programs, physician education, and media sources, the barriers of communication on issues regarding female sexual dysfunction and incontinence have been broken. Information on such conditions and its treatment is more readily available, and it grows the demand on such interventions. In turn, it is receiving a tremendous response and patient acceptance. Non-invasive procedures for ameliorating symptoms of genitourinary syndrome of menopause and vulvovaginal atrophy are increasingly emerging in the form of energy-based devices and injectable agents such as PRP, placental peptides, and fillers. Energy-based devices for vaginal rejuvenation harness their power from radiofrequency and laser sources such as carbon dioxide and erbium yttrium aluminium garnet, inducing the thermal dependent effect and matrix remodeling. In a chain of our clinics, we use the radiofrequency machine Thermiva, which is equipped with the unipolar handpiece that is applicable for both vulva and vagina. How it works? The radiofrequency energy stimulates the collagen first type production in extracellular matrix via the stimulation of fibroblasts. This process results in the contracture of elastin fibers, neovascularization, and improved lubrication. Recent studies showed an increase in small nerve fibers density in a papillary dermis. The creation of new elastin, which is relatively unique to radiofrequency, may contribute in the treatment of vaginal laxity. It is a lunchtime procedure with an average treatment time of 10 to 45 minutes, depending on the indications. 2 or 3 sittings are advocated, spaced approximately 1 month apart. The follow-up treatment or repeat single session can be done after 12 or 18 months. So this is a well-tolerated procedure by most of our patients because it is either pain-free or cause slight discomfort, and there is no downtime. Usual activities can be immediately resumed. Who benefits the most from energy-based procedures? Those women who have mild to moderate urinary incontinence, overactive bladder, vaginal dryness, decreased lubrication resulting in a painful intercourse, vaginal laxity, first grade of prolapse without cystocele or ictocele, those who have chronic vaginal infections and lichen sclerosus. Other non-invasive modalities that we use for genital rejuvenation include the use of injectable agents such as PRP, placental extracts, and hyaluronic acid. PRP is the most common rejuvenating injectable material used in the various parts of the body. Patients' venous blood is collected in special tubes and centrifuged to obtain supernatant of PRP. PRP acts by being very rich in growth factors with a fibrin scaffolding. Growth factors stimulate and recruit multipotent stem cells to grow new, healthy tissue. Placental extracts are rich in growth factors and cytokines, showing an array of physiological effects such as immunomodulatory, anti-inflammatory, cellular proliferation, wound healing, and regeneration. Hyaluronic acid, the cross-linked type, is used as a bulking agent for labia minora and majora augmentation in those women who complain of saggy and wrinkled skin in that area, and as well for G-spot amplification to enhance vaginal orgasm and to reach a tightening effect. Hyaluronic acid, the non-cross-linked type, used in combination with PRP or placental extracts and being injected in the vaginal wall, can give an amazing moisturizing effect. In our centers, we perform combination treatments, including systemic and local treatment, by using the stem cells and cellular extracts by means of intramuscular and topical application. Together with energy-based devices, we get the most effective and satisfying results. All the listed above methods help to address urinary symptoms such as dysuria, incontinence, recurrent urinary tract infections, sexual symptoms such as discomfort, pain, genital symptoms such as irritation, itching, dryness, and others. Some of the techniques work specifically in the erogenous areas such as clitoris and G-spot, enhancing orgasm, restoring the impaired sexual function, strengthening relationship, and bringing back our patients to a normal life.